And with the future of health care reform uncertain, the question remains, what tangible solution exists to reduce the skyrocketing cost of medical care? One San Francisco community health director is gaining recognition for a unique approach to providing affordable care at a time when the state of California needs all the options that it can get. It's been 2 years since President Obama signed the Patient Protection and Affordable Care Act.
It'll take 4 years to implement fully many of these reforms, but a host of desperately needed reforms will take effect right away.
California officials did act right away on insurance reform, passing legislation to establish a health benefit exchange, guaranteeing coverage for children with pre-existing conditions, and expanding Medi-Cal through new low-income health plans. If the Supreme Court declares the individual insurance mandate constitutional, then the next phase of federal reform rolls out in 2014. In California, an estimated 6.9 million previously uninsured will flood the primary health care system.
California is facing an enormous challenge with health care reform, and it's a challenge we should be excited about because we have chosen to bring about 7 million people into care. However, it's very clear that the current models of care cannot accommodate that many more people.
Long before the current debate on health care reform, UCSF nursing professor Pat Dennehy was working on an innovative solution to the rising cost of quality health care and the challenge of bringing it to the chronically uninsured.
There's a documented shortage of primary care doctors in this country right now. And even the projections are that we're not going to see this shortage solved. Nurse practitioners, however, are growing in numbers, and it is a group of people who are very attracted to this type of work. We're health educators as well as healthcare providers. This is what we do well.
Good morning, this is Fina calling from Glide Health Services. You just got to remind of your appointment.
Glide Health Services is a nurse-managed health center in the Tenderloin of San Francisco.
Mr. Warrior?
At our clinic, 90% of the care is rendered by advanced practice nurses.
I'm going to do your blood sugar.
Our patient population are people who have no insurance, people who are underinsured, those folks who would have no other way to receive health care services.
A lot of men, when they're not working, struggle with mood issues, including depression.
I used to be in a shelter because I doesn't have an income right now. So having come to Glide, it makes me more positive to see that they have so many people willing for outreach to you.
All low-fat diet, right?
Mm-hmm. Okay, perfect.
We provide primary care, urgent care, mental health services, recovery services, chronic disease management, and HIV prevention services. And also, we are a huge training center. We have a direct link to the advanced practice programs at the University of California. We are interdisciplinary as well. The only difference is that the nursing element is running the practice in our case.
Currently, there are about 250 nurse-managed clinics across the country. Glide is the largest on the West Coast. But even as this center continues to expand its services, funding for the future remains a constant concern.
We only have 28% of our population in insurance right now. The rest of the care is floated through a lot of creative funding.
Though nurse practitioners at Glide can diagnose illnesses, prescribe medicine, and perform other functions similar to doctors, many insurance plans refuse to recognize them as primary care providers.
Currently, there are many plans that will not list us as providers. This happened in Massachusetts. When Massachusetts passed health care reform years ago, they were unprepared for the numbers of people who came onto the insurance rolls. And they had to quickly look and find competent, trained people. I would like to suggest, along with my colleagues in the state, that we would like to change some of these rules in anticipation of our needs in California before we open the rolls and find there is no place to put people.
Well, that story was produced in association with the James Irvine Foundation.